Okay, Regine, thank you so much for being here today. I have a couple questions for you today. And number one, the first one we're going to start out, running a supply chain of a very sophisticated health system during the middle of a pandemic is difficult, if not very challenging. So with that being said, I'd like to hear maybe your low and your high in the last 12 months.
All right. Well, thank you, Hayes. Definitely lots of activities and lots of things happened during this past year. But I can tell you the high for me was when we had the opportunity to partner with a local provider in order to get PPE. Basically, it was right after the Mardi Gras season, and those seamstresses were basically out of work and with really not a whole lot going on. They leaned in and helped us put together this operation where we created PPE, which is something that I never thought was possible. And so the myth of PPE was shattered. They really leaned in and helped us fortify our PPE situation. And in terms of a low, it's more of a personal one, really, where I went I want to say almost like 3.5 days without sleeping, literally without a wink, because I was up on adrenaline, sourcing and running around and doing everything that needed to be done in order to make sure that we were keeping our caregivers and our patients safe. And I literally got to a point where I felt like I was crashing. And so I reached out to my VP of operations, Mark, and I will always credit him for really bringing me back into focus, where I broke down and I said, I feel like I can't do it anymore. I feel like I'm just breaking down and I am just completely exhausted. So he talked to me through, some mindfulness exercises and shared some information with me. And then we shared that with the team, and the team rallied around me. So that was like really wonderful. So it's a term of a low and a high as well, because it was really, really amazing how the team rallied around me, and I loved it.
Well, that's a great story, and I appreciate your transparency. I know that was obviously a tough time for you and your team and everybody else. And I know now the good news is we're starting to come out of this a little bit. And tell me a little bit about maybe how the vaccine rollout has generally gone with your system and maybe the community.
Well, Ochsner as an anchor in the community and the state really has been the leader at the forefront of the vaccine rollout. To date, I can tell you that we have administered probably close to 160,000 first dosage and about 110,000 second dosages. And so we're continuing to move in the communities, especially for Louisiana. Yesterday was a day that vaccines became available for anyone over 16 years of age. And so we actually started the day with what we called a Vax Fest. Nothing like a good New Orleans festival, always an excuse to have a festival. And so we had a Vax Fest with the crews and live entertainment to really encourage people. And from a supply chain point of view, we have been standing, shoulder to shoulder with all of those administering the vaccine to make sure that they have the supplies available in order to manage, the flow, because we've had quite a few, people turn out, and very successfully.
I bet that was fun, because New Orleans definitely knows how to throw a party better than any other city in the U.S. So that's obviously encouraging. Obviously, more and more people getting vaccinated is a great thing. And how is that impacting, or do you know a date yet that you and your team might be back in the office?
That's a very good question. This question is being asked of us, more and more. But frankly, for us here at Ochsner and for the supply chain team, we don't yet have a date, really. We're working through understanding, what our folks are looking for, and, whether or not there is a desire, willingness, and, or apprehensions or excitement about coming back to work. Actually, I just launched a survey administered by a third party so that people can feel comfortable sharing their thoughts and opinions about the idea of coming back. But likely, we're going to continue to have more interactive conversations with our team to ensure that, you know, the coming back to work program is done in a way that is thoughtful. I just have to say that, frankly, from our standpoint, we've seen the productivity go up quite a bit during the pandemic, and also the engagement scores have gone significantly higher. I believe that the supply chain is one of the organizations within Ochsner that has gotten the largest boost in the engagement score. And so when you really factor all of those, it becomes a little bit more, it becomes a little bit more comfortable that people are likely going to want to stay home, but we're probably going to end up in a hybrid situation where people can come to work, you know, as needed, or work from home.
Well, and obviously if they're performing well and your supply chain is working well, it makes a lot of sense to do that and keep the way you're going. So thank you so much for doing this. This is really informative, just to kind of get a feel for what's going on. And you do a great job at what you do, and we appreciate you taking a few minutes today. Thank you.
Well, thank you, Hayes.
All right, take care. We'll be in touch.